अस्सलामुअलैकुम दोस्तों, वेलकम बैक टू माय यूट्यूब चैनल। जैसे कि दोस्तों आपको पता है, हमने एक वीडियो अपलोड की जिसमें हमने पढ़ा है गैस्ट्रोइंटेस्टाइनल डिजीज़, डायरिया के बारे में हमने उसमें स्टडी की थी। ये तो यहाँ पर है ड्रग्स अफेक्टिंग द गैस्ट्रोइंटेस्टाइनल सिस्टम। पूरे गैस्ट्रोइंटेस्टाइनल सिस्टम पे जो भी ड्रग्स अफेक्ट करती है, उस ड्रग्स के बारे में हम आज डिटेल में स्टडी करने वाले हैं। तो चलिए शुरू करते हैं इस वीडियो को, आज के इस टॉपिक को। यहाँ से lecture outline discuss common symptoms disorder for which gastrointestinal drugs are used, describe use वगैरह वगैरह। तो आगे बढ़ते इंट्रोडक्शन। मोस्ट ऑफ द GIT disorder are related with motility. Non specific treatment of GIT disorder may be useful by correction of fluid and electrolytes balance. Rest of the GIT diet modification, provisions of nutritional support, alleviations of visceral pain, GIT related disorders in between other disorders, diarrhea वगैरह वगैरह। Drugs affecting GI secretions. There are 5 types of drugs that affect gastric acid secretions and are useful for the treatment of the peptic ulcer. Histamine H2 receptors and antagonist blockers, antacids, proton pump inhibitors, mucosals, protectants, progestagland analogous. Histamine H2 antagonists. Pharmacodynamics histamine H2 receptors blockers. These drugs block the release of hydrochloric acid in the stomach in response to gastrin. The H2 blockers tidance. Pharmacodynamics drugs action. The H2 blockers are antagonists at the receptors in the peritoneal cells of the stomach. The blockage results to inhibitions of the hormones gastrins. There will be decreased production of gastric acid from the peritoneal cells. Also, the chief cells will secrete less pepsinogen. Therapeutic use of the H2 blockers. Short-term treatment of active duodenal ulcer or benign gastric ulcer. Treatment of hypersecretory conditions like the Zollinger-Ellison syndromes. Prevention of the stress-induced ulcer and acute GI bleeding. Treatment of erosive GERD reflux disease. Relief of the symptom of heartburn and acid indigestion. Precautions and contraindications. Any no allergies are clear contraindications to the use of the agents. Conditions such as pregnancy, lactations, renal dysfunctions, and hepatitis. Dysfunction should warrant cautious use. Nizatidine can be used in hepatic dysfunctions. Dynamic side effects, adverse effect, GIT, diarrhea or constipation, central nervous system dizziness, headache, drowsiness, confusions and hallucinations. Cardiorhythms, hypotension related to H2 receptor blockage in the heart. Cimetidine, gynecomastia and impotence in males. Drug interactions. Cimetidine, famotidine, ranitidine and metabolites in the liver. They can cause slowing of excretion of other drugs, leading to their increased concentrations. Drug interactions. Use drug can interact with cimetidine, anticoagulants, phenytoin, alcohol, and antidepressants. Nursing consideration. Administer the drug with meals at a bedtime to ensure the therapeutic level. 1 hour after antacids. It states the importance of the continued use of the length of time prescribed. Monitor the cardiovascular status, especially if the drugs are given IV. Warn patient of the potential problems of increased drugs concentration if the H2 blockers are used with other drugs or OTC drugs. Advise consultations first. Provide comfort measures like analgesics for headache, assistance with ambulation and safety measures. because of confusions, warm, and patients taking cimetidine. That drowsiness may pose a hazard if driving or operating delicate machines. दोस्तों इस वीडियो को रखते हैं यहीं तक, मिलते हैं अगली आने वाली न्यू वीडियो में।